Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Absorption of cyanide. Cyanide gas, cyanide when given in gaseous form, that is hydrogen cyanide gas, can be absorbed rapidly, followed by absorption of acid, followed by salt absorption. When the salt form of hydrocyanide, salt form, that is sodium and potassium cyanide, is consumed, it combines with hydrochloric acid, that is sodium and potassium cyanide combines with hydrochloric acid to produce hydrocyanic acid. So if the person is achlorhydric is absence of hydrochloric acid. In such cases, the patient may not suffer from toxic effects of cyanide. That is, if the patient is achlorhydric, then the patient does not have hydrochloric acid, so sodium and potassium cyanide cannot combine with hydrochloric acid to form hydrocyanic acid. So there is no toxic effects of cyanide in this case.
thank you and thank you for watching.